why a lot of students are not able to clear this examination.
12 long hours in a class, it's not a joke. There was nothing new I was gaining or experiencing.
If I'm going to abroad, do you think it was worth it?
Definitely think it's worth it.
So what happened then that you decided, okay, now Philippines is the ultimate option?
The spectrum of the diseases in India is as good as Philippines. It's like a boarding school, I'll tell you like this. Put your child there, they train you till the end. When one goes, other parents also start inquiring about things.
When you had the opportunity to either take a drop or go to Philippines,
Never think of, taking drop.
if I'm going to go as a student, I don't expect any fun activities.
Any medical college you go to, medical means seriousness. You are dealing with a patient's life.
It is the way forward for me once I've cleared the examination.
A simple MBBS will not help you. You need to do PG.
When you come back to India, do you feel there is a partiality for the Indian students who have done their education from abroad? हेलो एवरीवन, आई एम अविनाश एंड आई एम सिटिंग विद डॉक्टर निर्भय एंड मेरे पास एक और डॉक्टर बैठे हुए हैं जिन्होंने फिलीपींस से अपना एजुकेशन कंप्लीट किया हुआ है। तो उनसे ही समझते हैं, उनके ही शब्दों से, कि क्या सिचुएशन है, क्या रियलिटी है और क्या सच्चाई है जो कि स्टूडेंट्स या पेरेंट्स के पास शायद नहीं पहुंचती। तो सबसे पहले आप इंट्रोडक्शन दीजिए अपना।
My name is Wasik, Dr. Wasik. I'm from Srinagar, Kashmir.
अच्छा।
I studied in Davao Medical School Foundation, Philippines. I started my education in 2015 there, joined my med school there, and then I graduated in December 2020.
Mr. Nirbhay, please introduce yourself.
Yeah, hello everyone. So my name is Dr. Nirbhay, Dr. Nirbhay Kutal. So I graduated in 2021. So and then I did my MBBS from Philippines. After that, I passed my FMGE exam here in India, and after that I just got my permanent registration from the medical council. Then I've been working for these 2 years, and then I have been simultaneously studying for my NEET PG right now.
So basically the thing is, actually I was planning for somewhere else, but God landed me in Philippines.
Okay.
And I'm very grateful, and I have no words to thank God for the reason I landed in Philippines in my college, because I have never seen such an infrastructure. I've traveled across a lot of countries. I've gone through, before I joined the college, let me tell you one thing, that I had gone to certain colleges where I used to see the environment and the structure and the quality of education, but it was not something that was going down my throat.
So what was off about them?
What was off was there was nothing new I was gaining or experiencing. It was just the same. I was not having any kind of sort of experience where I could learn something different or new. All the medical colleges were same, with nothing different, same old structures, with what you call the messed up classrooms, untidy I can call it. But I don't know, that's what I told you, I'm very grateful to God. When I landed in Philippines, Davao, it was completely a different thing. When we were there was a complete new building. It was even the building was opened right there at that time. We had a world-class library. It was a digital library. We had access to it 24/7, I can say. So in terms of education, we have no hurdles there.
Okay.
We would go through. Anytime we could use the library, anytime we could go into the college and use, it was very resourceful. In terms of education, it was very resourceful.
Okay.
And it was all included in the package. Nothing additional was to be paid.
So Nirbhay, the first question, why Philippines?
During my old days back, which I remember, I was not really, honestly, I was not really aware about the MBBS abroad. I just had, just a very few ideas about the other countries like Russia, China, Ukraine, and then the Philippines was basically new for me. I really didn't know anyone from the Philippines, but after doing all the research, somehow I came in contact with one of the senior consultant doctor. He is a consultant right now working in Maharashtra. So I had a talk with him, me and my parents, we all had a talk with him. Then eventually we came to know the people in our area who are doing the medicine in Philippines, the MBBS in Philippines. So we had talk with everyone, also with some of the doctors who did their MBBS from the other countries. And then after all the, after gathering all the information, we just realized that like it's much more better the Philippines. Like even the people who did from the other countries, they do think the Philippines is a better option.
Okay. So what was that divine intervention that made you decide Philippines? So like you must be having some other countries as an option. So what happened then that you decided, okay, now Philippines is the ultimate option?
Basically, my parents are doctors as well.
Okay, they are doctors.
Yeah, so what happened was the spectrum of the diseases in India is as good as Philippines. It's quite same. They have the tropical climate there as well. Even down south also we have the tropical climate. So the disease spectrum is quite the same. So my parents suggested me to go there because at the end we have to return back to our homes and we should know what we are treating and what we are dealing, because the disease spectrum is quite same in both the countries. So we had that clinical exposure of treating the diseases like dengue, malaria. You don't see it in like other countries like Russia because it's a cold place. You don't see dengue in Russia, but you see dengue and other things in Philippines, which is quite high in India as well. So it was very helpful for us to learn how to treat a dengue patient or malaria patient or TB patient even, because the ratio was quite high also there.
Now, I want to understand one thing, like since you were going to Philippines, what was the conversation you had in the drawing room or the living room? What was your father saying? What was your mother saying? Because obviously, I don't think they were sold in the very first go, like, okay, you should go to Philippines. Like it was not the kind of decision you take like while making a purchase online. Like it must be having some negotiation, it must be having some fears, it must be having some doubts. What were the doubts and how did like the family
Basically, let me tell you one thing. I'm from Kashmir, Srinagar. We come from a very conservative background.
Yeah.
And for us, taking a decision means quite a big thing. It takes a toll on your head as well as on your family. Not just you, but as well as on your family. So we had a chat and we were discussing about everything. We had these pamphlets which everybody distributes. So we were going through all of those things. But when I had a choice in selecting Philippines, what it made me select was, right from day one to the day of graduation and even after graduation. Because, there is one exam called FMGE licensure exam for those who study outside India. So those all key points were already included in this package.
Okay.
What I'm trying to say is that when I chose this, I know if I'm going to enter here, I'm going to exit out after passing my FMG exam. Not just getting my degree in hand, but also getting my FMG licensure, exam pass certificate. So that was something that my parents tended to, because they wanted a one-stop over, where you put it's like a boarding school. I'll tell you like this: you put your child there, they train you till the end. It was something like that. So that was something which made me decide this, and I was the only one from my place.
Okay.
To be the first one in the college. I don't know, even in the country, I was the first one to study there and finish my education. And after me, then when they saw the environment and everything, because when one goes, other parents also start inquiring about things. So the other parents also started inquiring, and they were very keen and happy to see something different, which the children back who have joined colleges before me had never experienced, because it's an Asian country only, it's a third world country, no, undoubtedly, but there was something which tends the new generation to lean towards, that is the Western culture. But we didn't lean towards the Western culture, but towards the Western education. Yeah, that was something which was very catchy for the eyes of parents, because they wanted to give the best.
What made you think that what were the points where you compared that, okay, Philippines has a better edge compared to these other countries? What were the pointers for you?
Yeah, first of all, the education pattern in the Philippines, like how they teach us how they are teaching in India, the MBBS pattern, the years, the subjects. this was my main concern actually, because after graduating from there, I do have to give the foreign medical graduate examination here. So the study pattern was accordingly, and then the way of their teaching, the point of taking exam, the way they conduct the exams there, also the practical knowledge which we should have. And then the other perspective things, if you'll think, is about the language, like if we definitely like if we are going in any other country, and then the language is the most important thing. So the people there, they do speak English, like almost everyone do.
So almost everyone speaks English in
everyone
Philippines.
do speak English there.
Okay.
Yeah, so it's like much more better, like when we when we had an internship there, when we were working in the hospitals, so we were like able to communicate, we are able to communicate with the patients there very, very well. So I mean, these are the points. And then the weather in the Philippines, the availability of the Indian food, these are all the things, which made me think that, I mean, this is the better option for me.
Okay, these were the better option for you. Now, as you mentioned that you have already cleared your examination and you have a license in the state of Maharashtra.
Yes.
Okay. So I want to understand one thing. If we compare that education compared to the education of India, especially the private institution, do you think you made a better choice? Because obviously students from private institution, if they have cleared the examination, they also have the license, you also have the license. Okay. So parents often think like, okay, if I'm going to abroad, maybe if I'm opting for abroad, that might be not the good pointer for me to start. So like, do you think it was worth it?
Yeah, I do definitely think it's worth it. Like, I can't really compare the private institution here and my education there.
Okay. Now, I want to understand one more thing. Like, since you mentioned like it was like a boarding school, so is it very strict school? Like, if I'm going to go as a student, I don't expect any fun activities. I just have to go there and study, or like.
No, see, any medical college you go to, medical means seriousness. Because
yes.
you are dealing with the patient's life. So in terms of studies, there was no compromise.
Okay.
There is no compromise. You have to attend your classes. If you don't attend your classes, your parents get a call in the evening that your child was not in the class today.
So how many calls did your parents receive?
To be honest, quite few. When I was sick only.
Okay.
I never used to skip the classes. After my attendance, I sometimes used to skip.
Okay.
After I get marked.
Okay.
After that, I used to skip. But when it comes to what you call that
Seriousness.
the college really pushed the students, towards studies, so that it's not just the college just wanted to extract money from the students. Because if at the end, even if you want to extract money, you must have that legacy to carry.
Yes, exactly.
If your name is built, you are certainly going to get the clients. If your name is not built, nobody is going to look towards you. That is what the MSF prioritized always. I'm talking about my college, I don't know about the others. So that is what they always prioritize, that there should be excellence. Excellence is what the MSF meant.
Okay, now we are talking about MBBS abroad of 2015 where you actually went, and this is 2025. So I want to understand what was the scenario, like what was the, like why you did not go for either for a drop, like obviously drop is always an option, or your parents would have said like, okay fine, let's spend money in the private institution, let's do it from India. I'm not sure about abroad. What was the thought process there?
See, actually what happened was I dropped a year.
Okay, you had a drop.
I tried my level best, but I couldn't make it to the mark. But that was all because of the subdivisions and the categories which
yes
unfortunately our children are today facing. And right now you see it's gone worst.
Yes,
in my time it was worse, now it's far more worst. So yeah, that was one point. And then when it came to India, foreign education is far better than our colleges. What I'll tell you, my personal experience, what children here get this in mind, that because you have to pay a hefty amount if you study in India, so that thought process changed. They think that our parents are paying hefty amount, so they become careless. you know, they have become borderless because they know anyhow their parents are going to pay. College is also, you know, they don't mind it much as long as the money they are making. So they don't push it to that extent. That was one thing, and another was also the financial, because you are doing an undergrad program which you are getting for a cheaper price, like 50% down. All you just have to do is study well, you pass your licensure exam, you're as good as them only. So that means you're saving it for the future, even if you have money. But as a wise person, any wise parent would do, if his child is really, you know, deserving and wants to do this medical thing, definitely he can go anywhere in the world for pursuing his undergrad program, because it saves him money. As long as he's studying, he's good in academics, he's saving the money.
Okay, so now coming to this examination of FMG, like since you are already a student, you were a student and now you are working professionally, you can speak with your professional experience as well. What is the reason why a lot of students are not able to clear this examination, being it just an examination and you only have the questions which you have studied in your whole education? What is the primary reason?
Primary reason I could say is seriousness.
Okay.
Because that's what I told you. Like, I didn't pass it in first go. Let me clear this out with you, because I tried to study on my own. I didn't know the resources, how to study, how to, you know, pass the exam, or I was just going through the notes. But you always need somebody who has been teaching, who is into this activity from quite a long time. What that is the main reason I could say that people are not passing. And the other reason is they are making it difficult day by day, and challenging for FMGs, those who study abroad. But if you go through what you have studied from day one, from first year of your college to the end, and if you are in the right hands, definitely you're gonna pass it out. I'll tell you my experience. I didn't pass it in one go because I was trying to study it on my own. And then I joined the Medical Academy Kings in Chennai, which belongs to our college only, Transworld Educare only. That's what I told you, it's a complete stopover. There we had classes, regular classes, and the environment was same just like that of our college only. So we were forced to attend the classes, listen to the classes, even if you sleep. I know it's very tiring, because you have to sit like 12 hours, 12 long hours in a class. It's not a joke. I know people fall asleep and your children and the lecturer is ranting there. It's hard, but something is always, there are sounds going on, you always are listening, something goes in your brain, and you really evaluate yourself and you see the question and something strikes it off, and you mark the right options. And that helped me pass the exam. Even if you go through the results from, I don't know, past 10 years or before that also, you will see DMSF has been ranking always in the top 10. And its passing percentage is almost 100%. That is something which the college has always taken into a serious note. They don't take a child is coming, studying here, and he is leaving with a degree. They want not just the child, but their parents' money also be, you know, be resourceful for what they have sent it for. Not just go all of that in vain. That's what I believe.
Okay. These days, a lot of students take 1 drop, 2 drop, 3 drop to make sure that they get the education in India. They sort of think like, instead of going to abroad, I'll take 1 more drop.
Right.
So what was your thought process that time, like when you had the opportunity to either take a drop or go to Philippines? Like what made you decide that, okay, instead of taking a drop, I'll go to Philippines?
When I was in, I guess around my 10th standard, so like it was like definitely sure what I do want to do. Like I had this goal, and then I always made sure that, you know, I'm not gonna I'm not gonna, like choose any other option. I'm not gonna settle for anything else. So MBBS was my goal. And then like since I was, with my teachers actually, during my 10th, 11th, 12th. So they were the one who used to always advise me, like you should be, I mean, if you want to do this, like there are many options. If you get here, it's very better. If you don't get it here, then you do have options. But never think of, taking drop. Or like if you're gonna, if you're gonna repeat one more year, yeah, it can be better. You will perform more better. You will get the seat. But if not, then you also have to look from on the other side. You're gonna be more frustrated. Your age will be increasing. These are the things. And also my parents, like they were also like very positive about this thing. Like they themselves don't want me to repeat the year.
Okay.
So like I was really sure, like if I'm not getting here, so I'm like there are many ways I can do it. So like that was very clear for me that I'm gonna go abroad instead of taking instead of repeating the year again.
Okay, fine. Now, speaking about abroad, speaking about Philippines, so when you were in the phase of taking this decision, like either I have to say yes or I have to say no, what was the conversation in the drawing room? What would your mother used to say? Like, is it a safe country? She must be having these doubts. Like your father would be saying, like, how will you eat? Like, what kind of a food they will feed? Probably your grandparents would say, like, okay, I don't want to send my son to the abroad country or something like. What was the conversation there, and like how you made the decision that okay, MBBS, Philippines is the good option?
Yeah, like parents can be always emotional, and like I'm the alone child actually.
Okay,
yes. So they were like more doubtful about all this thing, but like my dad was like more supportive with my decision. Like he knew that like I do also wanted to do this, and then he just had that trust in me, that maybe he had decided. So yeah, he will definitely do something better. And then like it's my dad who supported me, and then my mom was yes, she used to always think now if you're gonna go there, it's like you had never stayed outside the from the hometown. Like I've never been stayed away from the hometown, and then how will be the food there and everything. But like like talking with the people who are already studying there, and with the like all whatever we came to know. So we had an overall idea that there is availability of Indian food there. There are like this Indian even grocery markets there. So like it's not much more that hard or something. It's like just easy. It's just that you will be away from home for for a year, for a few months or whatever it is. Yeah, so it was like that. Like even if I did study here, and if I might have got somewhere in even if I might be studying in some other state, I think my probability coming to my hometown visiting it might be same, like once in a year I might be coming back. So it was same when I went to the Philippines. So I just think it's just about the distance and the boundaries, the country.
Okay, so you basically your mom was more worried than your father.
Yeah. Moms can be always emotional.
No, they are always emotional. They are supposed to be emotional.
Yes.
Yeah. So now one more thing I want to understand from your side, like how you made your parents convinced, like once you landed in Philippines, you started your studies, how you made how you convinced them that okay, this is the right place for me, because obviously they would be calling you 20 times a day, like did you eat? So how did you convince them, okay, you're not supposed to call me again and again, I'm eating properly, this country is safe, nobody is treating me the other way? Like how did you manage to convince, like what sort of a conversation you had in the early days of your education?
Right. Yeah, of course, like when I went there, they used to be worried. They used to be, calling me like time to time. So I did try to, make them more comfortable by showing them around, and then, telling my experiences that people are really kind here. You really don't need to worry about it. Like I'm, getting everything. The food is proper here. Whatever the place where I'm staying, they have all the necessary facilities. The college is good. The doctors there, those who teach us, the professors, they are also very kind with us. They do consider that we are foreigners and like we are adjusting in a new country. So they all are like very kind, very helpful. If ever like we need anything, they will be always there to help you. So like after like eventually few months passed, like they got used to it, and then it was like that.
And what about the patient exposure? Because obviously once you're pursuing medicine, so like if I talk about myself, I've been to many countries, and especially if I talk about in terms of MBBS abroad, they don't have adequate patient flow.
Right.
So what is the scenario for Philippines according to you? Like, since you have the on-ground experience.
Yeah, like the city which I studied, so like we had basically like 5 hospitals there, and the one hospital was included, the government hospital. So like during our clerkship internship, we say that we will always have our rotation in each and every department. The maximum time will be in the government hospital, and then again we will be doing our rotations in the private. And then we did had this, the skills lab, the OSCE things. Yeah, so we had all this. And the patient flow, there are like many patients, like we used to really get tired during our duties. Like it's I mean it's same like how we had how the students have here in India, and like they also have much not too many doctors. They also need as many as doctors working there. So yeah, the patient exposure is like much more better. You can practically learn so many things which an MBBS graduate should know. The basic procedures, whatever it is, we were able to get it. We were able to learn it there. We still had a skills lab also, like before performing on a patient, the skills lab, the OSCE. Yeah, so it was like much more easy, and the consultants there, like during our the clerkship or the internship, they were also they were sometimes sort of strict, but yeah, they were like helpful. They used to teach us a lot. So yeah, so it was really it was a good thing that it was a good thing that we were able to learn all these things.
Okay, so once you clear the examination, how is the path look like? How is the way forward? What is the way forward for me once I've cleared the examination?
Once you clear the examination, rest lies all in your hands. You can go for NEET PG. You can go for fellowship programs. A lot of fellowship programs have started in India as well. And you can go to abroad as well. It depends on you what you choose. If I was given a chance, I would definitely go back to Philippines for my PG program, but there are certain regularities still that have not met the terms. If given a chance, I would definitely go back.
Okay, you would go back. And what about India? So like once you cleared the examination, like how was the path in India looked for you? Like you sort of thought of going for NEET PG, or you thought of going to sort of a professional world where you will gain experience and then probably think about going into the this PG part of it? Like what was your thought process?
My thought process was very clear. Because a simple MBBS will not help you today.
Yes, obviously.
You need to do PG.
Yeah.
And even after PG, you are not fully satisfied. So I was clear in my mind, I need to go for PG. But then this government, this quota thing came up, which really started FMGs to push a back, by making you into all India category, then SC, OC, all that categories. That makes you think whether you belong to the place, or foreign countries like UK, US are offering you something better. I'm telling you one thing, that one of my friends, he was a very studious guy. He was a topper of his batch. He left the country, even though he could got a seat, open merit seat in India. But he believed his talent will not be recognized, and that's what made him go pursue his further education outside India. He cleared his exam, USMLE, cleared, and he is today working in US.
He's working in US. And where are you working right now?
I'm working in Nagpur.
Okay, Nagpur as a
I'm working there as a non-academic JR. I just gave my NEET PG exam as well.
Okay.
I'm there in Department of Pediatrics.
Now, one thing I want to understand, like obviously abroad education looks very fancy. Like obviously it is affordable. Obviously it sounds like, for some people they say it sounds too good to be true. Now, when you come back to India, do you feel there is a partiality for the Indian students who have done their education from abroad compared to someone who has done their education from the below par institution which is in India, or they have done their education from government?
Of course there is partiality.
So did you face that kind of a partiality?
Of course the exam thing was the biggest partiality.
No, exam thing is something which is for everyone.
For the Indian students, those who are IMGs, Indian medical student, they don't give any licensure exam. That is something, if there should be a screening, it should be screening for everybody. Yeah, you can make it step 1, step 2, that's a different thing. But if you doubt our colleges, thinking that we don't know what abroad people are saying or what they are teaching, are they capable enough? Same goes with you, because you're not always screening the Indian colleges as well. I think there should be a regulation where all the students should be given equal chances.
Okay. So do you feel that there are Indian students who have studied in India, they don't have the skill set which probably your classmate or you have, and you are facing that, what should I say?
Exactly, I'll tell you a thing.
Yeah.
It was a news as well. I don't know, was it true or not? I'm not sure about that, but it was quite on the social media that there was some guy who gave NEET PG exam. His rank was in minus. Just because he had money, he bought the radiology seat. I mean, does he make him capable enough to against a student who was studying, who's an open merit guy? Just because he was in open merit, couldn't get the level of score in open merit what they required, but was skilled enough to to be in that panel or be in that branch. That is partiality for me.
Okay, now let's come back to India. Once you completed your education, once you completed your this internship, you came back to India, you appeared for this examination. Once you completed your examination, you are now into the open world.
Right.
Like, how did the Indian people or Indian doctors treated you, being a student who has completed his education from abroad, like outside India, compared to someone who has completed from maybe a government institution in India or maybe a private institution in India? So like, were you treated separate, like differently, or you were treated like, okay, you're just a doctor?
I don't really think I was really treated differently. Like, it was like all same. The people here were also like good to me. Maybe some FMGs, the foreign medical graduates, that they might have this experience, but like honestly, I never experienced this. Like I was really okay, whatever, even the seniors here or even the consultants here. So yeah, they were like kind to me. They were like okay, and then it was like all sort of the same thing. Like what treatment the Indian graduates were getting, the same I was getting in the hospital.
Okay.
Yeah.
And if I talk about in terms of the infrastructure, so like how different, or I would say like how different was the infrastructure in Philippines compared to India? Like India has a better infrastructure compared to Philippines, so like what is your experience?
Like if you'll consider about it, I think the Philippines have more better infrastructure. The hospitals there are like more advanced. The facilities which they have, of course, it's like definitely better as compared to like some hospitals here in India. But like I think in India also, like we also have like so many advanced hospitals now. It just when it comes to some of the government institution, then there is like that kind of scarcity, like, or that kind of limitation they might be not having, which everything needed to be operated. But their government institution, they had each and everything. So their government institution, I will say, like it was like if you consider the AIIMS, the very reputed institution in India. So their government institution is somewhat like that. I mean, not exactly, but yeah. I mean, the hospital which we had an internship, it was almost like that.
Okay. So once you completed everything, the only question is like, did you get a job? And if you get a job, where did you get a job?
Yeah, of course I did get a job. Like after I passed, I got the license, then yeah, I did apply for the job. So yeah, we do get a job. I used to work in New Delhi I worked almost for like 2 years in New Delhi.
Okay, so like after completing?
Yeah, after completing, yeah, after passing and everything. Yeah, so I guess there are like always jobs available for MBBS doctor. Like although we in India also we do need a lot of doctors, so I don't think there is any problem for an MBBS graduate to get a job anywhere in the country.
So do you have friends who are probably working in a government sector who has completed their education from the outside India?
Yeah, I do have a friend, like one of my senior, he used to work in the government hospitals at New Delhi, and then also like here in Maharashtra, or if you'll consider about the other states. Some of my batchmates, yeah, they are working in the government sector right now. So it's, yeah, they do get a job. It's not.
Okay, so ultimately, how was your experience in Philippines? If you can sum it up in maybe few sentences.
Yeah, I do really. I mean, I think I made a very right choice at that time, that I was able to, go to the Philippines and, pursue my dream. And I think overall the Philippines is a good place. Yeah, the people are respectful there, and the most important, which we will think about, the education pattern and everything. When you come back, of course you're going to come back to India, then you're going to face the, challenges here. So whatever we do there, of course it will definitely, prepare you for your future. So yeah, I think it's overall, like, I really had a, best experience there.
Okay. Final piece of advice for someone who is thinking of taking a drop or maybe thinking of going to abroad.
The one who wants to repeat, I will suggest that if they are really sure, and if they're really, more stronger, then yeah, they should do repeat. But just hope that, they won't be getting sad, or they won't be getting frustrated, what they have to repeat again one more year. And if the people want to study abroad, of course they do have their individual choices. But yeah, I will definitely recommend that, if you do want to go abroad, like, please do, consider all the things. And if they will ask me what will be my personal choice or what will be my opinion, so I will say that, the Philippines is like much more better option for them.
Okay. So I want to understand one more thing from you, like, what is the piece of advice would you give to students who are thinking of pursuing education from abroad, especially parents, because parents think that the security part is the issue, or probably the education part could be the issue. So what sort of an advice you have for them?
Advice I'd go to parents first of all. Never push your children for anything if their heart is not willing.
Okay.
Let me complete. Let me, be open, very open with this. Because if the heart is not happy, he's not gonna be there with wholeheartedly, and he's not gonna learn anything. Number one. Number two, we can send our children abroad easily.
Yes.
Because, all we need to see is a peaceful, loving country with the, no
Good
hacks or
infrastructure.
anything. For that, I could recommend Philippines, because Philippines has good terms with India and with the nationwide. They are a very peace-loving country. Davao is one of the safest city in the world, if you know. You can Google it as well. You can send them there, and they can have a good life as well as the best education their parents would ever have imagined to give their children. Because I know financially a lot of people are not stable, but they want to push their children, or even if the child is what you call capable enough, but the finances make them, a bit hurdle for their journey to completely go through this. But yeah, I suggest every parent and every child, if you are willingly, with wholeheartedly going to go into medical, go it with whole heart. And the other things, like what I told you, is that either a country that is loving, peace loving, should send their children to there, who are globally recognized with peace loving, in peace loving environment.
Okay. So that was frankly quite inspiring. Like, I learned a lot from you. I hope the parents who are watching this video, they will be inspired by what you have said, and students will be inspired by what sort of a journey you have. Any final piece of advice you have for students who are preparing for NEET examination or probably looking for MBBS?
I would say, don't lose hope. Keep trying. Keep hitting hard. Struggles will come, but never give up.
Okay. Thank you. Thank you very much.
Thank you so much.